Hi, everyone. Thank you for being here with us. Today we are doing our WATES webinar on healthcare under the Trump administration and the 115th Congress. WATES, of course, is an acronym for What Are the Experts Saying? And we have a great expert with us today. But before we start, just a couple housekeeping notes. We will try to take any questions that we get after our webinar, and we have a lot to cover. So if you have questions for our expert today, feel free to use the chat feature on the toolbar to chat with the presenters and organizers. And like I said, we'll try to get to those as much as we can after the webinar presentation. And just kind of another housekeeping, something we always get is that you will definitely get the slides in an email after the presentation. So that's an often asked question, so I wanted to clear it up right away and answer it. So with that, let's get started.
Jenna, those are actually also downloadable already in the meeting. Yes. They are downloadable if you'd like to do it right now, as well as the white paper, and that's also in the toolbar under the download feature. So you can get it one of two ways. You can get it right now, or they are coming to you in an email. So with that, I'd like to introduce myself, and you heard Dan Chiptello, my co-moderator, jump in. Dan and I are happy to present this to you, and we're also really thankful and happy to welcome Kelly Rooney. Kelly is our expert today, and she's, of course, an associate managing editor of the explanations and workflow tools here on our health law editorial team. Kelly has a lot of content expertise, including, of course, the Medicare benefits and coverage, healthcare reimbursement, and healthcare reform. Welcome, Kelly. Thank you so much for being here.
Thanks, Jenna.
And let's kind of jump right in. There's a lot of breaking news here, and we kind of reordered everything that we wanted to present. And of course, the first one, or one of the biggest topics, is this ACA, and is it going to be repealed and replaced? A lot of news this week, right?
Right, yeah. So I'm sure everyone has heard by now. So on Monday, there were actually two bills proposed by GOP House members that are being reported as one repeal and replace bill. It's called the American Health Care Act, and this proposal is really just one of many, many bills being offered by both the Republican and Democratic members of Congress aimed at repealing or improving the Affordable Care Act, the Patient Protection and Affordable Care Act, or also known as Obamacare. So that's been in effect since 2010. There have been, in addition to these bills, even a House discussion draft that was leaked by the media in late February. But what Congress and Trump is trying to do with all of these different bills before us is trying to get some sort of health reform legislation in a state where it's actually going to pass when it's voted on. So all of these proposals take a slightly different tact at replacing the Affordable Care Act. And it's really uncertain at this point whether these House GOP bills, the American Health Care Act offered on Monday, is even going to pass Congress. It might be many months before we see a successful bill being voted on. Like I said, this American Health Care Act is actually two separate bills that comes out of two different House committees. The Ways and Means Committee's bill is focused mainly on tax issues. The Energy and Commerce Committee's bill is focused entirely on Medicaid. Both of these are reconciliation acts that only require a simple majority to pass. Now, I'm going to stress, though, that it's really early in the process. Around the time of Trump's inauguration, the GOP was saying that we'd have something to vote on sometime in March or April, but even Trump was pushing that date back, saying that it could take through the end of 2017, maybe even 2018, before we have legislation in place for replacing the Affordable Care Act. But there's a number of different, somewhat unorthodox methods being taken to repeal and replace the Affordable Care Act. Back in January, after the new 115th Congress started its session, both chambers passed concurrent resolutions, which showed the sentiment that the ACA was going to be repealed and replaced, and it also allowed for the ACA to be repealed through the budget reconciliation process, which is much more streamlined and a fast-tracked way of getting legislation through. Now, these budget reconciliation bills really seem to be the main method of replacing the Affordable Care Act. Although these reconciliation bills can only be used for spending and revenue measures. It can't do anything regarding portions of the Affordable Care Act that don't have anything to do with spending. But the advantage of using these reconciliation acts is that they only require a simple majority. They don't need a supermajority. It seems like they would be much more attainable right now and would avoid the threat of filibuster. Again, like I said, the American Health Care Act that was offered on Monday is actually two separate reconciliation bills. There's also a lot of talk going on about the number of executive orders that Trump has signed since his inauguration. Now, to be clear, what executive orders cannot do, they cannot repeal in one fell swoop the Affordable Care Act. That is an act of Congress. Only an act of Congress can do that. What it can do is give instructions to government agencies on what they should do on a certain topic. Now, this the ACA's executive order that Trump signed after his inauguration on January 20th is one example of that. It just really vaguely told the secretaries of HHS, of Labor, and of the Treasury, who are all big players in the implementation of the Affordable Care Act, that they need to do everything in their power to halt the implementation of the ACA. But it didn't give any explicit marching orders. We've also seen executive orders pertaining to reducing regulations by the federal government, providing oversight of regulations. These executive orders affect all agencies, all departments, but they also hit to the core of ACA repeal efforts, which is reducing regulation by the federal government and giving more power back to the states.
So there are several bills that have been proposed addressing the ACA, even prior to this American Health Care Act.
That's right. And I'm actually going to lead you through a comparison of some of the bills that were before us and talk about how they are addressing some of the big ACA-related topics. Now, the American Health Care Act is one of the bills that I'll be discussing, but I'm also going to point out the ones offered by Tom Price, Bill Cassidy, Rand Paul, and Paul Ryan offered a policy paper in 2016 presenting what he calls a better way plan, and that plan seems to be the basis for several other proposals that we have seen recently. I'm also going to be bringing up this House discussion draft that, again, was leaked in late February and was dated February 10th. And some aspects of that seem to have made its way into the American Health Care Act that was announced this week. So first off, let's talk about the individual mandate. That's one of the main provisions of the Affordable Care Act. It's the requirement that individuals have health care coverage, and if they don't, they're subject to a tax penalty. Now, these few bills that we're looking at mostly do away with the requirement to have health coverage, which might undermine the sustainability of plans. Looking at just the fundamentals of insurance, you have to have both sick and healthy populations paying into a plan, or it's not going to be able to support the payments for services to its members. And it's also going to cause premiums to increase in cost. Now, since Trump took office, he has wavered between saying that he's going to provide health insurance to everybody, or saying, like many people in Congress are arguing for, that insurance should be accessible to all, but not provided to all. What the GOP doesn't want is for it to be mandated. So that's why we're seeing this individual mandate being excluded from some of these bills before us. The bills introduced on Monday, again, that's called the American Health Care Act, would eliminate the penalties for individuals that don't purchase insurance. It also would eliminate penalties for employers that don't offer insurance to their employees, and that is retroactive back to 2016. Going forward, though, there is an element of penalization. So if someone were to go without insurance for more than 2 months, they would have to pay a premium that is 30% higher for an entire year when they do get health insurance coverage. So there is one aspect of penalization in the American Health Care Act. Now, whether people purchase coverage when they're not required to do so, and whether they're going to purchase coverage when they're not covered by Medicaid or employer-sponsored plans, that's all yet to be seen. But most of these bills provide for some amount of tax credits in order to help individuals purchase coverage. Under the ACA, individuals are provided with refundable premium tax credits computed on a sliding scale. But in contrast, one of the bills that were introduced as part of the American Health Care Act would put into place new age-based, not income-based tax credits to purchase insurance starting in 2020. These other bills that you see on the slide suggest flat age-based tax credits that range in amounts between $900 per person and $4,000 per person. Depending on where you are purchasing a plan, what plans are available to you, premiums differ drastically. So it's really unsure whether these credits are going to be nearly enough for people to purchase their own coverage, and they might be left footing the balance of the premium, which might prove unaffordable for most.
Kelly, two other topics, the mandate, the tax credit issue, those are always, individual topics that people were looking at when we talk about, the ACA or moving forward. But a couple of other ones are things like annual or lifetime dollar limits and pre-existing conditions. How do these handle those topics?
Yeah, those have been in discussion ever since, the ACA was in its creation as well. So annual and lifetime dollar amounts, those are topics that come out a lot of times when you're talking about insurance policies. The ACA prohibited plans from having annual limits or lifetime dollar limits. But these various bills that we have before us are really split on whether they're going to continue to prohibit those types of limits in healthcare plans. The American Health Care Act, introduced on Monday, would keep those annual and lifetime limits prohibitions intact. When it comes to pre-existing conditions, that's another big topic. The ACA prohibits health plans from excluding people from coverage due to pre-existing conditions that they might have. But again, the bills are kind of split on whether that's going to continue. Some plans are saying that they would allow people to be excluded when they have a pre-existing condition for just a small transition period. But another topic that has gotten a lot of press is the coverage of dependents through the age of 26, which the Affordable Care Act provided for. That topic seems to have a lot of support and has gained a lot of popularity because it seems to be present in most of the replacement bills that are being offered, with the exception here of Tom Price's bill. So that seems like that's going to continue. The American Health Care Act did keep that in place as well.
And what about, no matter what proposal people are going with or getting behind, it seems like the whole issue of Medicare expansion is always a hot topic. It's always, almost discussed separately from whatever plan, people are proposing.
Right.
It's
Yeah, the Affordable Care Act, just to set the stage, expanded Medicaid so that more than just the people who had previously been eligible were covered under state Medicaid plans. And it also, the ACA gave to states additional funding to expand Medicaid in order to expand that eligibility. But when it comes down to it, Medicaid is still a jointly financed program that is split between the states and the federal government. Now, these bills that are being offered are somewhat approaching the financing of Medicaid a bit differently. So the argument is, the argument to change Medicaid financing seems to turn on the predictability and the ability of the federal government to budget for the cost of Medicaid, because under the current joint financing system, it's really an unpredictable cost, and many are arguing that if we reformed that system, it would better contain healthcare costs. Paul Ryan proposed in his A Better Way plan either a per capita allotment or block grants to finance Medicaid. But the per capita allotments might not account for, they're saying, drastic changes in the number of people that are covered under a state program that might occur mid-year. And block grants might not allow state plans to maintain the current level of coverage or even to provide the same services to people covered under Medicaid if those states are left to finance amounts in addition to what they are currently putting in towards Medicaid financing. So what ends up happening with Medicaid is kind of uncertain. A couple of these GOP bills that we have before us are leaving the Medicaid expansion provisions from the Affordable Care Act in place. But this certainly is going to be a big topic going forward.
Yeah, definitely. And I think this is kind of an interesting segue. Obviously this was, in the news, on top of people's minds. But when we look at some of these proposals, we look at who maybe some of the key players are, right? And, Tom Price is one of them. And when we look back at, what Donald Trump campaigned on, during his run at president, we look at maybe who are some of his key players and who he's put into positions to advance, what he's promised during his campaign in regard to healthcare. Who are those players?
So sure, as far as his cabinet goes, yeah, he's really casting the roles. So we're setting the stage for the repeal of the ACA. First, there's Tom Price. Tom Price is a private practice orthopedic surgeon who was, he served on the GOP as a GOP member of the U.S. House of Representatives for 12 years. Prior to that, he was on the Georgia State Senate. His claim to fame is that he has proposed the same ACA repeal bill several times, the Empowering Patients First Act, which we talked about on some of the previous slides. He was confirmed as Secretary of the Health and Human Services Department back on February 10th. There's also Seema Verma, MPH, who was nominated as Administrator for the Centers for Medicare and Medicaid Services back in November. Now, she's a policy consultant who spent her career traveling to various states in the Midwest, trying to redesign their Medicaid programs after the ACA was enacted. Most recently, probably most notably, she worked in Indiana with previous Indiana governors, first Mitch Daniels, later Vice President Mike Pence, as the architect of the Healthy Indiana Plan, HIP 2.0, and that's the state's consumer-directed Medicaid program. Now, Verma has not yet been confirmed. She cleared the Senate Finance Committee, but a full vote before the Senate is up next. We don't have a nominee yet for the Commissioner of the Food and Drug Administration. A couple of names have been thrown around, but this is a really important role. Trump campaigned on a lot of topics related to drug approvals and food safety, so that's going to be a topic that continues to be brought up into the future. To fill the vacancy in the Supreme Court left by Antonin Scalia last year, Trump nominated Neil Gorsuch, who's a judge out of the 10th Circuit Court of Appeals, where he had been seated since his nomination by George W. Bush in 2006. Gorsuch penned actually the concurring opinion in the Hobby Lobby v. Sebelius case as that action made its way through the Court of Appeals before reaching the Supreme Court. The Supreme Court ultimately upheld the 10th Circuit's holding in that matter regarding the contraception coverage mandate of the Affordable Care Act. He's seen as very conservative, really fits the same kind of ideology as Scalia did. His confirmation hearings have not yet started, but if he's seated and more healthcare matters wind up before the Supreme Court, we might see something similar to the holdings that were coming out of the 10th Circuit.
And Kelly, before we go to looking ahead, were there more things on the current proposal, kind of a summary that should we jump back over there? Or is that...
Yeah, let's jump back to the American Health Care Act that was announced on Monday. There's some important details that I think I would be remiss if I didn't highlight for everyone. But again, let's re-emphasize, okay, so this is two different bills that came from two different committees. So the first one, the Ways and Means bill, focuses mainly on tax issues. It calls for the repeal of the individual mandate, which we mentioned. It also sets forth a plan to offer tax credits that are going to help individuals purchase insurance coverage, which many GOP members of Congress are upset about. They see that as just another Democratic-like entitlement program. But the tax credits, they would disallow tax credits for plans under which abortion services are covered. The Ways and Means bill also would do away with the requirement for employers to provide coverage to employees going back retroactively to 2016. It would eliminate the medical device excise tax, the tax on tanning beds that came out of the ACA. It would delay the Cadillac tax, which heavily levied some of the most generous employer-provided plans, pushing that tax back to 2025. It maintains the prohibition on excluding people with pre-existing conditions. It maintains the dependent coverage through age 26. Those are both so popular under the ACA. It also keeps in place the requirement that health plans offer a package of essential health benefits, but it would exclude abortion and some contraception coverage. And then the second bill coming out of the Energy and Commerce Committee is almost entirely about Medicaid. In addition to repealing the Medicaid expansion put into place under the ACA, the American Health Care Act seems to propose to convert Medicaid into a per capita model where states would only receive a certain amount of funds from the federal government per enrollee. It seems, however, that until 2020, states that have not already expanded their Medicaid programs might be incentivized to do so because the federal government will continue paying ACA rates for newly enrolled people through 2020. In addition, the Energy and Commerce Committee bill would eliminate all federal funding for Planned Parenthood, which is not at all related to the Affordable Care Act, but it's something that has been a goal for many Republicans for years and years. Now, to be clear, although these Republican sponsors of the bill and the White House are both calling this an ACA repeal and replace bill, I'm really hesitant to call it that. It would actually leave the vast majority of the ACA intact, and it seems to only address and affect the most contentious provisions coming out of the Affordable Care Act. The ACA actually revised and added about 600 sections of the Social Security Act. If you compare that to what is contained within the American Health Care Act, that one only seems to revise or add about 30 sections of the Social Security Act. So everything else remains in place. What we also
I know you don't have a, sorry, Kelly, I was going to say, I know you don't have a crystal ball, but where do you think this is going to go? Do you think that, it has enough support to continue forward? What do you think?
You know, we're already hearing reports coming out of the Senate that there are 4 Republican senators that are saying that they're not going to vote for it. All of those senators happen to be from states that have expanded Medicaid, and they seem to be thinking that they would be doing a disservice to their constituents if they were to vote for this. What is really uncertain with this bill, in addition to all the others that we've been talking about, is that we don't know how much it's going to cost. What hasn't happened yet is the Congressional Budget Office estimates. So typically, any bills that are proposed before Congress run through these CBO cost estimates. Now, when you're talking about something like an ACA bill, it's looking at how the uninsured rate is going to change as a result, how many people would obtain coverage through Medicaid, and currently at least through health insurance exchanges. We don't have any of those figures right now. So, you know, I think once some of the costs are a little more obvious, we might be hearing, you know, maybe even more people saying that they're not going to vote for it. We do have, coming out of the Joint Committee on Taxation just yesterday, estimates on how the American Health Care Act would affect revenues. So they were looking at specifically the provisions regarding rolling back some of these Affordable Care Act related taxes, doing away with the medical device excise tax, delaying the Cadillac tax, getting rid of the tanning bed tax. And that joint committee actually found that that portion of the American Health Care Act would result in something like $266 billion in lost revenue over the next 10 years. So there's been a lot of organizations coming out already against the American Health Care Act. The American Hospital Association hates it. Rand Paul is calling it Obamacare Light. Others are calling it Obamacare 2.0. But whatever you want to call it, it's obviously not the complete repeal that Trump campaigned on. So I would not be surprised if this battle continues for months and months to come.
Yeah, it's definitely going to give you and your colleagues a lot to write on and a lot to follow.
Absolutely.
So I think we could talk probably about that for about an hour, but I don't want to forget about some other topics. And these were, again, topics that President Trump campaigned on and he really talked about. You know, there are other health topics and other things that we're going to continue to follow. So can you run those down briefly, what you're looking at, what you're following?
Specifically, we're looking at, you know, some of the things that Trump had campaigned on. You know, he talks about the idea of saving money for Medicare. Nothing new. Almost every incoming president is talking about that. But he was really setting in his sights drug costs. So he was arguing that the government should be able to directly negotiate drug prices with the drug companies directly. Now, what Trump is actually going to do on this matter is really uncertain, because back in January, he met with a group of executives from pharmaceutical companies and completely sidestepped that issue. He instead was pointing to streamlining the FDA in order to save costs or lower costs for Medicare. After the meeting, Sean Spicer did say that Trump was still in favor of it, so maybe we'll be hearing more about it. We're hearing about, you know, efforts to, again, further deregulate, specifically with regard to drug and food regulations. They're saying that they're too burdensome, slow, and expensive. Trump brought up the FDA drug approval process in his address to Congress on February 28th, but he was giving an example of a 9-month-long drug approval process as being really slow, and many people in the research and development industry came back and said, no, that's actually really fast. So there are elements of perspective on how long this should take. Safety versus effectiveness is also weighing into the drug approval process. And we also are expecting that there would be some sort of food safety regulation changes coming out, although I really have no details on that yet.
Great. Well, a lot to follow, and a lot that I think will be hotly contested by all sides. So thank you so much for being our expert today. There were a lot of great stuff, and again, I have a lot of questions on how they get these slides, and you can either download them again on the toolbar or they will be sent to you. So any other questions that I may have missed, Dan?
I don't think so.
Okay, sounds good. So thanks very much, Kelly. Great job. Really appreciate all this info. And thank you so much, everyone who's attended. We appreciate your being here on our What Are the Experts Saying webinar. And again, you'll get an email in addition to those slides that'll have a really brief survey link. And actually, what I do is I take your responses, maybe topics you're interested, et cetera, for WATES webinars going forward. So if you could just take maybe 30 seconds to complete that link, it would really help us determine what topics are of interest to you. So again, thank you so much, Kelly, and thank you so much to all of our attendees.
Thank you.